The rest of the story is such a God thing. We were continue to be in awe of how we were delivered from this situation and how God chose to heal Ruby. And we are honored and at times humbled by the fact that he chose us to raise such a miracle. And that's part of the reason why we feel, I don't know if obligated is the right word, but I don't know the right word, so I'll say obligated. That's why I feel obligated to share her with you, because she's remarkable. We ended up being in the hospital for a full month. And after January 16th, that's not to say that we didn't have hard days, because we did. We had other struggles. Ruby developed a new blood clot that couldn't be treated because we were protecting her brain, and that was a complication. Once it was clear that her seizures had quieted down and the active swelling in her brain had subsided, they were able to begin backing off of the sedatives. But we were told at one point that Ruby was on enough medication to take down a horse and a cow. So because of that, and she had been on this medication for such a long period of time, that she was suffering from narcotic withdrawals, which was very difficult. But I'll never forget one of the first days. It was real, one day she would just move a little bit more. And then the next day we could see where she was just trying so hard to open her eyes. And we would talk around her bed, and one of the EEG techs told us that in those days that her brain would light up with activity at hearing our voices. So even though she wasn't awake, she was hearing us. And I just hold really tight onto that, that she knew we were there with her the whole time. But one day when she finally did start opening her eyes, I was talking to her, and she started smiling at me. And so pretty quickly after that, I was like, well, I have to record this. And so I did, and it is one of my most cherished videos of all time, because she was not very far removed from having been in a coma, and she woke up and she smiled. And that was so much. We didn't know how she would be when she woke up. We didn't know. We just didn't know. There was no way to know. And the doctors couldn't tell us how she could be. We were told that babies are resilient and their brains can rewire themselves after an injury, but that it's hard to tell, and there's no way to guess if it'll happen. We were told there are babies or kids walking around the neuro floor that literally have half a brain, and you would never know. But by that same token, we were told that there are kids with small amount of injury that you would think that they would be able to recover easily from, and they end up having severe deficits. But from a personality standpoint, when I saw that smile, I knew that that was my daughter, and that she was there, and that she had not left us. And then, once she was able to start waking up more and more, she was having physical therapy and occupational therapy come in and work with her, but ultimately she was awake enough to where they felt like they could extubate her finally. And the doctor said, the attending doctor that week said, at some point we have to do it. Even though Ruby scares us all, we have to do it. We're here and we're prepared to intervene if we need to. But ultimately they were able to pull the breathing tube and switch her to CPAP. And I got to hear her raspy cry for the first time, and it was just so good to hear her voice. She was able to de-escalate off of oxygen support pretty well. They took it really slow so as not to rock the boat, but ultimately she was able to go from CPAP to high flow nasal cannula, and then ultimately to what they call room air, which is just breathing on her own with no support. And so once she was extubated and it was evident that her heart was still doing okay, then her surgeon was comfortable finally moving her pacing wires. So after open heart surgery, she had wires on the outside of her body that were she was wired for a pacemaker, even though they never had to pace her. And so once she had the wires removed, then she was finally able to go for her MRI, which I will speak to in just a minute. But just when she first woke up, I mean, there was no left side movement. And then she started lifting her leg again. And then she started ever so slightly moving her arm. And I mean, just with every day that passed, she was doing more things than we could have hoped for. The day that she was extubated, the attending physician from our first week there came back to the floor to see for himself. Once she was extubated, she was able to start eating again by mouth. Eventually, this was, I mean, we're talking weeks. Everything, I'm telling it quickly, but it was progressing over many, many days. And once she was able to start eating by mouth, she really was able to turn a corner again. Well, spend some time talking about the MRI read, because this was a very significant day for us. Obviously, we prayed for like a grand miracle, like brain to be completely healed and everything they had seen on the CT scan to have just been an anomaly. That isn't what happened, as many of you know, but I will never forget the doctors giving us the news that they did. And so basically they pull up her scans and they show us the areas of her brain damaged, which were most of the right side of her brain. And then they tell us what areas those control. And by the time we were getting the MRI read, Ruby was already awake. She was still struggling with medication weans, but we were seeing more and more of her come back to us every day. And so there wasn't a whole lot that they could have told us that we didn't already know from our own eyes. And so doctors have described Ruby's brain injury as massive, as devastating, and as traumatic. Like those are like I don't know if they're clinical terms, but those are the terms they use to describe her brain injury. And so when they went through the MRI, they told us that the main areas of concern would be Ruby's motor skills on her left side, and her vision. So basically, we really pressed them, and we were told that we were told that it was unreasonable to expect that Ruby's left side movement and strength would ever match that of her right. That the best we could hope for is that she could regain some functionality. We really pressed them on walking, and they said based on the scope of her injury, in their opinion, that if she ever walked, she would require some assistance. So walker, braces, something. They do not believe that Ruby would walk on her own. One of the other main areas of concern is Ruby's vision. And so we had really noticed this already in therapy and just in being with her. So basically Ruby's vision in both eyes is cut. She has no left side vision in either of her eyes. And so her visual plane is a little more than half, because this center eye kind of curves over. And so, and then also we've dealt with on and off a condition called left side neglect, where Ruby just doesn't know her left side is there, so she doesn't use it or attend to it. And when they gave us this news, they truly felt like they were giving us some of the worst news of our lives. And it's not great. I don't celebrate the fact that my daughter has these obstacles to overcome, but devastating would have been telling me my daughter was brain dead and giving me, like, having to pull the plug on her. You know, what you told me is not devastating. And so we told ourselves in that day, like, we have to accept this, and we have to accept Ruby, and the best way that we can help her, as she's waking up, I can hear the little miracle now. The best way that we can help her deal with her differences is by accepting them today, which is something that we continue to struggle with, but ultimately it's just become a part of our new normal.
Ruby. Hi. You want to nose a little bit? Nose, 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 nose. Yeah. Yeah, there you was. There you was. Good job, baby.
I know you're able and I know you can save through the fire with your mighty hand. But even if you don't, my hope is you alone. I know the sorrow and I know the hurt would all go away if you just say the word. But even if you don't, my hope is you alone. You've been faithful, you've been good all of my days. Jesus, I will cling to you.
She knows she is the star of the show, and she knows when we're talking about her. Yeah, you do. We are forever changed by what happened in January. For better and for worse. For better because I don't mourn Ruby stages. So I can remember with Wyatt being so sad when he would grow out of clothes. I can remember putting away clothes and knowing he had worn them for the last time and it making me sad. Or when he couldn't sit in his bouncer chair anymore, or when he was too big for his swing or his mini crib, those kinds of things. I can remember that made me sad. And so I don't mourn those things with Ruby because we are so grateful that she's here and that she's growing. Because when you're faced with the possibility that your child might never reach their first birthday or go to school or graduate school or get married, when you're faced with the realities that they might not see those things, you are so excited for the new things that they do see. And it makes you not mourn the growth, if that makes sense. I'm not saying we don't have days where parenting is hard. We do. But life is so short and so precious. and it helps us stop a little bit more and soak things in and just be so grateful. One of the days we were in the hospital, we while Ruby was in a surgical procedure or in a CT scan, we signed Wyatt up for T-ball, not knowing how long we would have been in the hospital. If you would have told me we would have spent 3 months in the hospital, I would have said probably. And so I can remember signing Wyatt up for baseball and never knowing like if Ruby and I would be able to be there for opening day or for any of the games. And so the day of opening day was one of the happiest days we've had in 9 months, because like it was just like, once again, just this physical reminder of healing and of miracles. I get a little cheese ball sometimes. But one thing that came out of it was that we didn't get the peace of mind we had hoped for after surgery. We got a lot of other things instead, and that's okay. We still continue to work through these things. James and I both give each other our own space to handle things, not meaning like we don't work through it together, but we both understand that we process things differently. So for me, I process things by thinking about the worst case scenarios. That way I know what is possible, and then I can see that doesn't happen. Like I know as bad as things could be, and so when it's not that bad, then it feels good. Because if you, I don't know, none of this probably makes sense, and I know that I'm rambling here as I'm trying to wrap this up in a nice clean bow, which probably is unrealistic, but we just, and James's way of handling things is just to not think about things or stress about things until the time that it becomes necessary to do so. He's so capable of compartmentalizing, and I am just not. Our road has had many bumps along the way. We have this team of doctors between our cardiologist and our primary care physician and our neurologist and our hematologist and now our physical therapist and occupational therapist, and not even counting our newest specialist, which is our neurosurgeon, which will be my next video to share. But we have this medical team that has Ruby in their hands, and we continue to feel so confident. And so ultimately we ended up being discharged. Like I said, once Ruby began eating on her own, it was lights out. She took her first bottle by mouth on a Friday. By Sunday, she was taking like 80% of her feeds by mouth. By Monday, they said they would pull the NG tube, and she decided to pull it out herself. Yeah, you did. You pulled that tube out. You were just trying to help. Yeah. And so we were discharged on the next Tuesday. So it was just crazy how quickly, once she decided to turn the corner, how quickly she did. And from the time she came home, it was just like this. Every week she was either regaining something that she had lost. So, we're talking about learning to hold her head up again. She had not been sitting up unassisted previous to her stroke. So that's still something that we're working on, but she's got great head control. One of the first things that she worked really hard to do again was to start rolling over both ways, from back to front and front to back. And it's a slow process that took a bit of a setback, but it's continual, and it's amazing, and she's doing wonderful and remarkable. And her therapists have not ruled out the fact that she'll walk. And so obviously we're continuing to move forward and go to therapies and help her to gain that function that's necessary. But I said this in a Facebook post, and I mean it, like, if she never walks, like, we can be okay with that. We'll get her the prettiest wheelchair we can find, and we'll help her be at peace with it by coming to peace with it first. I don't know, the song that's playing on this video is Even If by Mercy Me, and it's one of the videos that, or one of the songs that, I mean, I just cried out to the most during this stay. And the line that still raises the hair on my arms is, God, when you choose to leave mountains unmovable, give me the strength to be able to say, it is well with my soul. And those are not words you ever want to sing, because you're basically submitting to the fact that, God, I'm praying this out, and I know that your answer might be no, but I love you, and I praise you, and I give it all to you. And I had a lot of comments throughout our stay of people telling me that I was so strong, and I don't feel strong even today. But one, I'm raising her. Like, how can I not be strong when she's the strongest person there is? She shows me how to be strong daily. But also, like, you just don't have any other choice but to submit wholly into your faith and to give every single bit of it to God and know that He is good and His will is good. And people talk a lot about God not giving you more than you can handle. And I don't exactly believe that, because I believe that sometimes God gives you so much more than you could possibly handle on your own human strength, that it forces you to lean into Him and to use Him to get you through. Because I didn't get through anything alone, and James didn't get through anything alone. Like, we got through this because of God and God alone. And maybe that's why. Maybe that's why all of this happened. I mean, we don't ever know and may never know, other than the fact that we just get to witness a miracle with our own eyes every day, which we are so grateful for. But I will wrap this up and move on and, continue sharing the next parts of Ruby's journey. And I've mentioned before that I'm so excited to just take you along our therapy journey with us. And we just thank you from the bottom of our hearts for your continued prayers for our family, because they have literally breathed life into us. So thank you.
Oh, you're able. I know you can. I know you're able, and I know you can. See through the fire with your mighty hand. But even if you don't, my hope is in you alone. I know the sorrow, I know the hurt would all go my soul.